Kid Power is committed to building healthy communities and fostering community engagement. And we know that our students are poised to be leaders in our schools and our communities. So I'm thrilled that we have an all-star panel today to discuss these issues. First, we'll hear from Dr. Charles Chavis, who will help unpack for us some of the history underpinning trust within the healthcare system. Dr. Chavis is an assistant professor of conflict resolution and history at George Mason University, where he is the director of the John Mitchell Jr. Program for History, Justice, and Race at the Jimmy and Rosalind Carter School for Peace and Conflict Resolution. Dr. Chavis's work focuses on the history of racial violence and civil rights activism and the ways in which the historical understandings of racial violence and civil rights activism can inform current and future approaches to peace building and conflict resolution. Next, we'll hear from Alicia Jordan, who will discuss efforts at Mary Center to provide culturally competent care in the community to a targeted population. A registered nurse and master's in public health by training, Alicia joined Mary Center in 2018 as the Director of Clinical Services. She oversees the clinical nursing team and works to standardize practices across Mary Center's various sites. Ms. Jordan spent several years as a labor and delivery nurse at MedStar Washington Hospital Center, where she discovered her passion for public health. Prior to joining Mary Center, Ms. Jordan worked at the Teen Alliance for Prepared Parenting, a secondary adolescent pregnancy prevention program. Finally, we will hear from Ronald King, Community Relations Specialist for the District of Columbia's Department of Health. He comes to us today as one of the department's principal spokespersons to communities throughout the city on the coronavirus. Mr. King has an extensive career in public health, including his work at the Committee on Health at the DC Council before serving in his current role at the Department of Health. I'm currently personally very excited about all the federal hooks that Mr. King has worked on and managed, including the first CDC-funded outreach program in DC for Black and Latino sexual minorities. He managed programs funded by the NIH and SAMHSA, Substance Use Mental Health Services Administration, co-founded the DC Needle Exchange Coalition, and authored legislation creating the Older Adults HIV/AIDS Education Program. So before we get started, a quick housekeeping note. At the end of the three presentations that we'll have, we'll open it up to Q&A. So please feel free to enter your questions into the Q&A function of the Zoom, and we will do our best to respond during the Q&A time. So with that, let me turn it over to Dr. Chavis to kick us off.
Great. Thank you so much. Everyone can hear me okay? Great. Yeah, I just want to thank Kid Power for this opportunity, for putting this panel together around this topic. As someone connected to communities of color and someone who is of African descent, I deeply am interested in the ways in which we can be productive around providing communities with support they need, specifically around COVID-19 and getting the vaccine. I have been asked to kind of lay out the history that really informs a lot of the reticence on behalf of communities of color throughout this country. And it needs to be clearly stated that there is a long history of bias and unethical treatment towards communities of color in regards to both public health and the healthcare system. That needs to be clearly stated and understood. And most historians and most commentators will point to the Tuskegee experiments, right, as one of those main issues and those historical episodes that have really colored the experiences of communities of color, specifically around their abilities to trust their government, specifically around public health, right? However, it's important, and as a historian, it's always my job to complicate the historical traditional narrative. And we have to understand, in the Black community, as someone who is a descendant of enslaved, this distrust and mistreatment began at that period, right? During the period of enslavement, when women, Black women, were experimented on, right? And for the sake of medicine, right? We also have children as well. Specifically, there's a little or known case around the individual by the name of Vertus Hardeman, who was a child who was experimented on with radiation. And he was one of those individuals who, as a child, was experimented on for the sake of, medicine. I'm a Baltimore native. I did my PhD, not a Baltimore native, but I did my PhD at Morgan State University in Baltimore. And Henrietta Lacks in the Black community is an individual whose name to this day is lifted up by members in the Black community who have a reluctancy and a distrust to this day regarding going to hospitals in Baltimore, right? There's so many other nameless Black people and people of color whose historical experiences have colored and really laid a case for the distrust, right, that we're trying to deal with. And I think we really have to sit in the mess of it, that trauma, and we have to understand that trauma. And when we talk about specifically laying out a path where trust can be built today, right, it has to begin with this acknowledgement of the truth, right, and this truth telling. And we have to be able to sit in that as a country and as communities, really listening to these communities and their trauma. We can't hear the same old things that we've heard in the past, that this is the past, let it go, right? My mom recently is a teacher in North Carolina, and she's preparing herself mentally to get this vaccine. And everything that she knows about this history are the things that she talks with me about, right? The Tuskegee experiments, knowing that we're the descendants of slaves and how women were treated. All of these things are going through people of color, their minds and through their thought processes when they hear the government yet again pushing us, right, to get this vaccine. And what I think COVID has really highlighted is something that communities of color have always known, right, that they are disproportionately impacted systemically within our medical system. This is what's kind of frustrating as well when we look at communities of color who are looking at the government response and the other responses from government, local state officials pushing us to get this vaccine. It's like as if these other issues that are ongoing and systemic, right, around these having universal healthcare and having access to mental health services and insurance, all of these things, right, have to be understood as a systemic issue. And if I think, moving forward, if the government as well as local state officials want communities of color to really own this and be a part of it and feel comfortable participating, we have to have a larger conversation about what resources beyond COVID-19 are going to be provided to support communities of color, specifically within our medical system. We have to have a conversation about how we're going to address systemic racism within the healthcare system and within the public health system in this country. And that, for me, is one of the first things that the government can do in order to seek the trust for communities of color around this specific vaccine. Because at the end of the day, when Black communities, when we receive, when our population will receive these shots, when we receive these vaccines, we still have to deal with this medical system that we have had a problematic relationship historically, as all of the institutions that people of color have had a problematic relationship with. And I think for Black communities and communities of color at this current moment, where we're in the midst of this racial reckoning, we are very reluctant to participate when we're not seeing long-term solutions, right, regarding the systemic wrongs and ills that communities of color have been facing for over 400 years, right? And so I'm not going to steal the thunder from Ms. Jordan, but I think for me as a historian, and why I practice conflict resolution is because I see the utility in history and understanding this trauma as we begin to build resources and culturally informed care, in which Ms. Jordan is going to talk about. How can we build these type of care within our medical system if we're not informed or we don't have knowledge of this historical trauma and we sit in this trauma, right? So I'll pass it on to Ms. Jordan from there, but thank you all for this opportunity, and I look forward to hearing from the other panelists.
Thank you, Dr. Chavis. And before we turn it over to Alicia, a question for you that occurred to me, and I really appreciated hearing your systemic framing of this, that this is not a COVID-specific issue. This is not a recent issue. This is a challenge that has plagued our healthcare system and our public health dynamic really since the outset. And so I'm curious, beyond COVID, looking forward, what you see as some of the biggest priorities for building that trust within the system. One thing that occurs to me that I've read about is representation, that there are fewer Black men entering medical school today than there were 40 years ago. I'm curious what your thoughts are looking forward beyond the pandemic. What are some of those efforts that you see holding promise?
Yeah, I think to your point, there has to be more representation throughout the medical system, not just in specific spaces. Right now, and this is off the top of my head, I know that there are there's two HBCUs with medical schools that I'm familiar with. We have Meharry Medical College as well as Howard University. And please correct me if I'm wrong on the panel, but it shouldn't be up to those institutions to really diversify and provide the cultural competency needed for medical professionals, right? I think what we have to do as a country is recognize that this is a job for all of us. And our failure to deal with systemic racism is not a job that the Black community or communities of color should have to take on their own. Because at the end of the day, when you look at this, the communities of color, what they're doing is giving America, again, another chance. They're believing in the various principles of democracy and equality that are within our Constitution that they have yet to feel be realized for them, right? And so in communities of color, there's always this unique relationship with the American government and with the larger America, if you will, the country, if you will, where we're constantly calling our leadership up to be more inclusive and representative of being a representative of our needs. And so that is something that we have to be cognizant of, and we can't allow communities of color to be re-traumatized by trying to take on this burden by themselves. And that includes Black medical professionals and others. I think there has to be a willingness for whites and others to understand this trauma and do this difficult work. So the solution is not going to come with having more people of color in the medical field. I think that's important, and that is a step forward, and that is beneficial. But at the end of the day, it's going to take all of us. And that is a harder and difficult conversation because it's forces America to deal with this systemic problem that we have, right?
Thank you, Dr. Chavis. And I will turn it over now to Alicia for her presentation.
Good afternoon. Thank you for having me here. I'm grateful to Kid Power for being chosen and selected as a panelist. And I love and happy to talk about what Mary Center has been doing these last few months to administer the COVID-19 to the communities most at need. So just a little bit of background about Mary Center. We are a federally qualified health center with 3 sites in Washington, D.C., 1 in Montgomery County, Maryland, and 1 in Prince George's County, Maryland. We serve about 55,000 participants every year from over 50 countries. 70% of our participants identify as Latinx or Hispanic, and about 75% of our participants identify a language other than English as their primary language, with Spanish and Amharic being the 2 most common. So we received our first doses of COVID-19 vaccine from DC Health, very gratefully, Christmas miracle on December 24th in 2020. And we had a very limited amount to get out to our staff and to essential workers. And over the next few weeks, we got more and more doses to begin to give out to our participants. And kind of our first strategy in COVID-19 outreach was promotion. One of the most effective strategies in vaccine use is a strong recommendation from a trusted provider. Mary Center has over 30-year history of being a trusted provider in particularly the Latin American immigrant community in DC and the surrounding areas that we serve. And so one of our biggest pieces was promotion amongst our own staff. Our staff not only reflects the communities that we serve, but they come from the communities that we serve more often than not. And so making a targeted effort to encourage our staff to get vaccinated. That included holding question and answer sessions and doing our Open Voices series, which is our racial and equity series at Mary Center, to really address and discuss the medical distrust among Black and brown communities, particularly around the context of the COVID-19 vaccine. And so as a result of our efforts, we're very proud to report we have about 75% of our entire organization has been vaccinated. including 100% of our providers, about 99% of our nursing staff, and about 90% of our medical assistants. So we've had great success with that. So once we first received the vaccine, we were a part of the DC Health portal, which allowed DC residents who were eligible for the vaccine to sign up directly through that portal and get vaccination appointments at our site. We recognized pretty quickly in the first week or so that the patients that were signing up through the portal were not the patients that we serve, and they didn't reflect the communities that we serve. And so DC Health recognized that as well and supported us in kind of taking a step back from the portal and really doing targeted outreach for our communities. So we literally generated a list of all of our participants who were eligible for the vaccine, and we called them individually and asked them if they wanted the vaccine. So we had a team to call. If they did want the vaccine and elected to get the vaccine, they were scheduled right away or put on a waiting list, depending on what our vaccine availability was. If they had additional questions, they were scheduled with the provider for a telehealth visit. And during that outreach, we found about 75% of our participants wanted the vaccine and said yes. And I will say that the other 30% weren't necessarily declines. Some of those we weren't able to reach. Some of those participants had received their vaccinations elsewhere. And some of them just had additional questions. And I want to really highlight, there's a lot of discussion around vaccine hesitancy among Black and Brown communities. And certainly it does exist amongst some participants and some of our patients. However, having questions about the vaccine is okay and should be normalized. This pandemic is brand new. It's novel to everyone. This vaccine process is new. The average person doesn't understand how a vaccine is made and kind of the things that go into it. So it's really okay to have questions. And that's something that as an organization, we really believe, and we encourage our patients to have questions. And so through our targeted outreach process, allowing those participants, when we're giving that personal phone call, coming from their trusted provider as Mary Center, who's handled the rest of their care, not just medical, but maybe behavioral health or dental, really taking care of their whole families, saying, I'm nervous, I have concerns. And having their provider who is vaccinated and is available to answer those questions in that moment has really been a big turning point in encouraging our community to get vaccinated. Now, we recognize targeting outreach to all 55,000 of our patients is going to be an impossible task to keep up. And so, we are working through other strategies to reach out to our participants. We do have our own portal where people can sign up, and we'll have a phone line where people can get a call and access our clinic specifically to get vaccinated. As we move on, I think the next part is partnerships. So we recognize that we can't do it all. In addition to providing COVID-19 vaccines as an organization, we're still doing our regular everyday services, providing medical care for our adults and our children and our pregnant population, still providing dental and behavioral health care. So we need to partner with other organizations to really reach the communities that we serve and the surrounding areas. We have a partnership with DC Health and the Faith and Medicine Initiative, where we have a community partner that goes to churches that serve Black, East African, Latinx communities and provides the vaccines at the churches directly, bringing it directly into the communities so that they're going to a trusted place in their community to receive the vaccine. We're continuing partnerships with that with Montgomery County as well, as the Montgomery County Latino Health Initiative, as well as the Prince George's County Equity Initiatives, to really get the whole community vaccination events, not just for our own participants, but for their families who may not come to Mary Center for their everyday care, or the surrounding communities that our clinics are located in. And so we've definitely had success. About 96% of all the vaccines that we've administered to our participants and our staff have been to people of color. And we are, as a community health center and a federally qualified health center, we're given vaccine because we're trusted and we have success in reaching those communities that we serve in those communities of color. So going forward, just supporting, receiving that support from DC Health and from HRSA and from our surrounding local governments where we serve, to continue to be that community of trust to reach these people that are most need of the vaccine. Just a little background on our current numbers, we've given about 7,338 total vaccines, 5,255 actually individuals vaccinated, And additionally, we've done about 5,000 vaccines through our Faith in Medicine initiative. And so, yes, I'm happy to answer any questions about our process.
Thanks, Alicia. And the work that you described is really inspiring and a real testament to the trust and footprint that you guys clearly have in the community to have been so successful. A question on just how the process goes when you call one of your patients and they have questions. I'm curious if you know what that looks like. What are typical questions or concerns or issues that folks raise, and how you guys are able to overcome that?
Yeah, sure. So we do have different members of our team that are calling out. Sometimes they're medically have a clinical background, other times they don't. And if they don't, they're referred to someone with a clinical background. And we do have, we're doing weekly calls with our health education team to answer any questions. And our team does phone banking as well, like with Telemundo and partnerships, to be able to reach people who have questions about the vaccine. I think some of the more common vaccination questions are, am I going to get COVID from the vaccine? I think that's kind of, it happens with the flu vaccine as well. That's kind of one of the bigger questions. There's a lot of questions about, you know, we hear mRNA and, you know, people worry about if there's going to be any change to their genetic makeup or any problems with fertility. And so those are some of the most frequent asked questions. And we make sure that every member of our team understands it, those questions, those answers to those questions themselves, and actually having a visit with their provider, a telehealth visit, to go over those questions. And we get a lot of support from our local governments to have visits like that we're doing a vaccination counseling visit and understanding that and really dedicating the time to address the concerns that participants have.
One question that we just got is whether you've identified within your patients, whether there are specific age groups or other factors that may be more apprehensive or have more questions than other parts of your patient population.
I can probably say anecdotally, I don't know if we have hard data. I do know that when the vaccine was first rolled out, there were a lot of our older patients were very eager to get it and we're very excited. There was a little bit of delay getting vaccine in Maryland. We only had it in DC for some time. And when Maryland finally opened up, it was a huge relief for a lot of our participants to come in. We're just starting to transition to our younger participants and our healthier participants, really, who don't have comorbid conditions and things like that. I do think there's a lot of questions around pregnancy and breastfeeding and fertility. And so those are that population that is affected by those questions. Those are definitely coming up.
Got it. Well, we will save the rest of our questions for the Q&A period. And at this time, why don't I turn it over to Ronald King?
Hello, everybody. Listening to Ms. Jordan, I can say everybody should know why Mary Center is one of our favorite community partners. They have been tremendous in helping us reach the Latinx community and many of the immigrant residents in the city. And so it's great hearing her discuss all that Mary Center is doing. I can vouch for everything she said. I've been asked to discuss where we are in terms of how many shots in arms. So far, 237,000 of our residents have been partially or fully vaccinated. Now, our population with the latest census count is just under 700,000, about 657,000. So we still have a good ways to go. But fortunately, in the District of Columbia, Mayor Bowser, unlike some of the governors of various states who got their advice from non-healthcare professionals, our mayor has listened to her public health officials. And so we have taken a very proactive and aggressive approach in educating our public and in addressing many of the concerns and hesitancies that Dr. Chavis mentioned of folk who were very hesitant about getting the vaccine. We have had to contend with the anti-vaxxers and many of the conspiracy theorists in educating folk and persuading them to be open-minded and to listen. And so we've had to work through a lot of that. In the city, Ward 4, which is in Upper Northwest, has had the most cases, followed by Ward 5 in Upper Northeast, Ward 7, and then Ward 8. Well, Ward 8, which is not number 1 in cases, is number 1 in deaths. And that speaks to the inequities in the city. We're often cited in popular magazines, People and others, that Washington is the most educated jurisdiction in the country. We are the wealthiest. A couple of neighborhoods in Ward 3, Spring Valley, Chevy Chase, are the healthiest neighborhoods in the entire country. But yet, just several miles away to the southeastern portion of the city in Ward 8, we have very high indices. In fact, the life expectancy for residents in Cleveland Park is a full 15 years greater than those in Congress Heights in Ward 8. And so when the CDC, and we do follow CDC guidance, but when the CDC mentioned early on that it would prioritize those over 75, we differed with that, and we set our priority rating, I should say, or ranking at 65. And why was that? Many Black men don't live to collect Social Security. So had we waited for, well, let 75 be our marker, so many of our people would not have gotten the early attention and intervention that they needed. Black men in Washington and in this country have the lowest life expectancy of any demographic in the country outside of Native Americans on the reservation in Montana. And so we had to tailor our approach at targeting individuals. Early on, folk were traveling from the far western portion of the city, the affluent area in the city, to far southeast to vaccination sites to get vaccines because they were educated and realized the importance of vaccines. And yet we had so many people in the areas with the high incidences of death being hesitant. And so we doubled down on our outreach efforts before we locked down in March of last year. We were going to civic associations, ANC meetings. We have ANCs in every ward in the city, 300 plus ANC commissioners with single member districts. And so we would regularly go to these meetings. And then with the lockdown and presentations becoming virtual, where we couldn't be right there to touch folk, we used all kinds of media. Youngsters on Instagram, they use TikTok, they use other social media, whereas many elderly folk are not even internet connected. That's particularly a bad case with folk in the far eastern portions of the ward, where folk have no connectivity. So we reached out to young folk and said, share this information with your grandparents, many of whom are raising them. You cannot walk down the street in Washington without seeing a youngster with an iPhone to his or her ear or in the palm of their hands. And those are mini computers. And so in the early days, when we were having folk sign up through the internet portals, they were crashing because so many folk wanted to be very first. So we realized that we, in addition to that, had to switch strategies. And so we decided, as opposed to going by who called in first or got in first, that we would select people randomly and then call them to give them appointments. And so things, after we switched to that method, have moved very, very smoothly. And there's been quite a demand for vaccinations, we're glad to say, and people are testing. So in terms of our outreach efforts, in addition to using all of the various social media, there are also platforms where elderly folk can call. You don't have to do Zoom. I did a presentation just recently in the far southeast corner of Ward 7, where the Civic Association president there let folk know, the seniors in her community, that they could call a number. There's a 1-800 number they could call. So they aren't visible, but they can call in. And so they don't need a computer in that instance. And so we're able to reach folk. One of the things that we're doing now that so many of us have been teleworking and so many of these meetings have been virtual, they're going well into the night. It used to be at about 8:45, the janitors would start looking at their watches and saying, okay, folk, we've got to lock up at 9. Well, a couple of weeks ago, I didn't even start a presentation until after 10 o'clock. And so we're just using every means that we can get to get the message out to people, and it's going. Fortunately, we now are allowing people to come to our 70 locations throughout the city where they don't even need an appointment. We have a good supply of vaccine, and even though there was the suspension of the Johnson & Johnson temporarily, we are in good shape with the Pfizer and the Moderna. And so folk who want a vaccine can get the vaccine, and we continue to reach out to folk and to walk them through some of the anti-vaxxers and the conspiracy theorists, to share with them that unlike last century, this century, one of the doctors who developed the Pfizer was an African-American doctor right up the street at NIH. Dr. Nesbitt, the director of DC Health, has convened a scientific advisory group. And so many of us even participated in the clinical trials. And so it's not a matter of us not being involved. We're at the table. And so I think that is helping, and working with community partners such as Mary Center and other community partners throughout the city, we've been able to tap into the various ethnic groups here in the city. We translate everything, not just Spanish, but Chinese, and we use Mandarin and Cantonese. Certainly Amharic is important, French, we even sign language. So we do extend ourselves to the entire community, and look forward to continuing that outreach.
Thank you, Ronald. And before we open it up for a broader discussion, a few DC specific questions for you. Curious if there are goals or strategies related to schools that you could talk about with respect to vaccinations.
Exactly. The mayor hopes that schools will be open in the fall. However, even now, some of our private schools have had in-person schooling. We have a presentation coming up with one of our ANCs, because there has been some concern in that neighborhood where even in the same household, some of the kids who are in private school have been able to attend, whereas some of the kids in the same families who are public school students have been studying remotely. And so that is a concern. The situation there is, when you're dealing with schools, when you have teachers and different age groups, we had to make sure the teachers were vaccinated. The clinical trials did not include children, so they were not in the clinical trials. There are a few going on now where hopefully soon we will see, perhaps by the beginning of the calendar year, younger children. But even today, 16 and 17-year-olds may get tested at Children's National Medical Center, Children's Hospital. and we're vaccinating everybody from 18 up. We have noticed that in some of the young children, there have been some respiratory conditions, not COVID specific, but COVID-like, and they've been treated at Children's Hospital. So the concern has been not to reopen too soon, as we have seen with some of our states. We've always tended to operate on the side of caution. We're watching the devastation, I should say, taking place in India now, which had been doing very good initially. But we're hoping, we have been doing the virtual learning with our schools, but we are hoping to get back certainly by the fall. And there will be some summer programs. And even during this year and during the epidemic, those schools that were able to adjust in terms of the PPE and all, and the partitions and all, have been able to have limited numbers of students in person.
Excellent. Thank you. Maybe I'll open it up now and pose a question to the group, though Ronald and Alicia, I think you may have some thoughts on this. So you both have worked in health and public health related campaigns for years now. Do you think with the coronavirus, there's a greater attention and awareness to equity, and have lessons been learned from prior public health challenges with respect to health disparities?
We're using folk in communities who are very well respected in those communities who help us. In fact, if some people on the Zoom call vaguely recognize this bald-headed guy before you, who looks very familiar to the guy up on the bus shelters throughout the city, that's yours truly. So we're using, and Elisa, you've probably seen on the bus shelters in Columbia Heights, Ivan Ortiz Torres, who works very closely with you at Mary Center. So we're using community partners who are well known in their respective communities to help us. And so we're using bus ads, subway ads with faces of people can relate to. We're going to churches. We've been doing a lot of special initiatives with our churches. So we've been just using all of the lessons we have learned from previous campaigns to tailor them to be culturally competent to those particular populations we need to reach.
Yeah, and I think just to echo that, I think health equity it feels like the last year or so has been a perfect storm, not just with coronavirus and how communities of color are disproportionately affected, but also the social justice movements and what has been the climate of our country in the last year related to race and ethnic race relations. And so I think it's kind of a perfect storm where everyone has to come together and realize that Black and Brown communities are at risk, public health risk, not just with coronavirus, but with racism and the undercurrents of systemic racism as a health risk to Black and Brown communities in this country. And so I think a lot of health centers, Mary Center included, I think has always been rooted in equity for our participants over our entire history. But I think really looking at a closer look of what we're doing as an organization and how we can improve it as an organization to kind of reduce some of the barriers, even within our own participants and some of the inequities within our own participants, not just with the pandemic, but beyond the pandemic with our other health measures as well.
Max, did you mind if I chimed in real quick?
Please.
Yes, I think for me, I wanted to make sure that people understand in many ways that the Black experiences and the experience of people of color in this country is really an experience of tragedy and triumph. And I think what we have to do in this focusing on narrative change, specifically around destigmatizing issues around COVID-19 and health disparities, we have to do a better job. The media has to do a better job of centering the Black intellectuals, scientists, and leaders who were a part of the development of this vaccine and who are on the front lines doing this work. right? It should not be a specific like a we shouldn't have to turn on CNN and see a quick glance of the doctor. These individuals need to be profiled. They are indeed American heroes, and they should be treated as such. And there needs to be more of an emphasis on shining a light on these people and what they've done. These people of color who, even in spite of their past experiences and historical trauma, have fought and really came to the rescue of America yet again. Our young people need to see these people out front, and so I think that's something I wanted to like really lay out as well. I didn't want to just focus on the tragedy piece, but there's triumph in this as well. And those who have risen to the top and overcome the systemic issues to continue to fight for this country in this specific area need to be profiled and honored.
And building off of that, a question that we got for Dr. Chavis, but I think really for the whole group, we're very pleased to have the three of you experts here with us today. A question I think from the audience that's helpful is, you know, what can we as individual members of our own communities be doing to help advance confidence, access, unpack and address some of the challenges that we've talked about today to help promote vaccinations across the board?
Yeah, I think just the openness in the conversation piece. A lot of what Ms. Johnson's doing at Mary Center is really, when I was hearing her discuss the work that they're doing, it's really about the community and building that relationship and that trust. And that is something that is not easy, and it takes time and resources, right? And I think that is kind of like what the orientation that we have to have as we engage these vulnerable communities, specifically around getting this vaccine. And so education is central, and not just a one-sided lecturing type of education, but a community-centered, community invested and approach that is really human-centered, right? And this is really counter to a lot of what is really traditionally been lifted up as the standard in this country. But in order for us to be successful, communities have to be centered in not only the administration, but also the conversations around layout, the conversations around implementation, around everything. I mean, so yeah, those are that's something that I think is essential, is having that community-based approach, the word of mouth, having a conversation about it. Because, when you deal with any vulnerable population, it's everybody's pushing shots in arms. Hold on, let's have a conversation, right? What does my religious leader think about this? What are some of the people I look up to? What's going on here, right? Those are the kind of things that I think have been effective in terms of the rollout. There are things we can hang our pride on. But I do want to highlight again the importance of within that narrative change work and that community building work that needs to happen. We have to bring the medical professionals as well as the scientists who are responsible for this work. We need to bring them before our communities, not just when we're dealing with a pandemic such as this, but all the time. They need to be there and present consistently so that our young people can see the power in the power of their people, as well as so that the country can really recognize that this is an American issue that we all have to deal with and be a part of solving.
Ms. Jordan, Mr. King, I'm curious if any other thoughts you wanted to add on kind of at the individual level, guidance and recommendations for us in the community to help with this effort.
Yeah, I think just to echo the sentiments of Dr. Chavis, sharing your stories. I think individuals sharing their stories, the power of an individual story is very strong. I could even speak to myself early in the pandemic when I posted my picture of me getting my vaccine, and I had friends who are not in the medical field who said, "Thank you for getting it first and telling us," because we were worried and we had concern that they needed to see someone that they trusted getting it to feel comfortable getting it themselves. And I'm happy to report that they're vaccinated now too. I had a friend who wanted to wait a little longer, but she got the opportunity and she saw that I had it and she got it. So I think the power, I think we look to these big campaigns and these big events and they're important, but I think we don't want to discount the power of an individual to make a change into their immediate community and encouraging someone to get the vaccine.
I say ditto to both Ms. Jordan and Dr. Chavis. Many people who were hesitant early on, as they saw their relatives, their co-workers, neighbors getting vaccinated, decided, hey, maybe it's not that bad. And they took the chance and did. So on an individual level, as we move forward now, hoping to get to a point where we will have herd immunity, it's so important with the various variants now that we get people talking to folk one-on-one in their households, in their neighborhoods, because viruses need us to survive. And if we can get everybody vaccinated, then there are no available hosts for them. So the more hosts that there are, unvaccinated people, the more likelihood of additional variants, and this thing will just go on.
Last question for the group. I like to end things on an uplifting and forward-looking view. What do you guys see as amid all of the pain and trauma and challenges and loss of this past year, when we think about equity and the importance of centering this in the vaccination effort? What do you guys see as a bright spot from what we've experienced over the last year that we can carry forward?
Well, I'm happy to say that we far surpassed the goal that the president had set for 100 million doses in his first 100 days. We're over 200 million. And certainly we're seeing more and more folk getting tested now. And because of our very proactive approach in the district, we never did get the devastation that many other places did, even though the 1,105 deaths we've experienced are certainly tragic, and we mourn them. But we are in so much better shape because, I think, of the cultural competency we've employed in dealing with a multifaceted population here in the district.
I think from Mary Center's perspective, it's been a long year with a lot of changes and challenges in delivering healthcare throughout this pandemic. I think the bright spot is, after several months of just really hard work and lots of pivoting amongst our staff, when we got the vaccine, people were so excited to volunteer, to work overtime, and to work weekends to give the vaccine. And that's still the case. I thought it would start to wane down and people would get tired, but it's still the case, 4 months later, that people are just excited and eager to sign up and have joy to be able to finally give the vaccine and see the light at the end of the tunnel throughout this pandemic.
I think for me, one of the biggest takeaways that we should hold on to, there was so much debate during the Trump administration and previously around healthcare. And I think what we've learned over this past year is that healthcare must be a human right, that all citizens should have access to. So that's something that I hope that we're able to take from this and push this forward and recognize that COVID-19, this whole situation should not have had to happen for us to really understand that, but here we are, right? And I think we should embrace that moment and continue to push for a healthcare system, promoting a healthcare system that is more equitable. I think all Americans, hopefully through this experience, we're beginning to understand the importance of that.
Excellent. Well, I want to thank all of our panelists for joining us today, for the discussion, and more so for the work that you guys do every day in our communities to build awareness and help uplift health outcomes. So thank you. A few closing housekeeping notes. On behalf of Kid Power, the speaker series, as I mentioned, is brought to our community as a benefit that was created in honor of Kid Power's co-founders, Max Skolnick and Caroline Scholl, who had a vision that young people could become agents of positive change. Members of the Founders Club share a deep commitment to the academic, social, and emotional development of our students and our DC community. And I want to let everyone know that after this session, we will be sending out information about the Founders Club for those who may be interested in joining, to receive invitations for our upcoming sessions. The next speaker session will be focused on a similarly important topic, food insecurity within DC and the impact on our youth. And we'll also be sharing materials from our panelists if you want to learn more about the work that they're doing and access some of the resources that they talked about today. So please join me in thanking the panelists again for the wonderful discussion, and please take the short survey at the end of this session. Thank you for joining.